Hi there.
Hey, hello.
Hey, so today we are talking about what practitioners agree is one of the most common muscles to cause pain in the lower back.
Muscular pain, yep.
And that is the Quadratus lumborum, or better known as the QL. So today we're going to be talking about self-care that you can do to help relax this muscle. And in our first video, we talked all about the location of the QL, how it helps our body move, and then there's a ton of referrals that are in the glutes and in the front of the groin. So if you're having pain in that area that you can't explain,
Yep, or lower back pain.
yes, check out that link, and that gives you some great information. But today it's all about self-care.
Self-care,
right?
okay. So real quick, we'll just cover again the location. There's two of these muscles in your lower back. Basically from the last rib down to the what we call the crest of your hip, so this ridge of the hip, and it actually attaches to several of the vertebrae, 1 through 4 of the lower, the lumbar vertebrae. So that's the location. And when this thing is, do you want to talk about common causes, or do you want me to just go ahead?
Yeah. Let's talk about causes. What makes this muscle tight first? But I forgot to tell you that we are Brian and Christina from Your HealthySteps, and we're the creators of the Ultimate Foam Roller Blueprint. And our goal, our passion is to teach you practical self-care skills, right? And foam rolling so you can be pain-free and active.
All right. Foam rolling with a purpose.
Yes. And so we've shared this information with many of our clients before. We've been massage therapists for the past 15 years. And so we wanted to share this information with you too, because we know it's so helpful.
Absolutely. Absolutely.
Okay, so this QL, what makes it unhappy? Couple of things. Number one, if you're a mom and you've been holding a baby on your hip for the past year, couple of months, that's a great way to make this muscle short and tight. Yeah. Sitting for long periods of time, sitting for long periods of time in bad posture, sitting for long periods of time but in an uncomfortable position, you know, where like one hip is higher than the other.
Or laid back in a car.
Yes. And then also improper lifting. Instead of using your legs to lift something heavy, using your back. And that's what Brian was guilty of when he was younger.
Horrifying.
Yes.
And another one I was thinking, just as we were talking, is runners, when they run on the road, because the road is beveled, right? And you run on one side of the leg is going to be longer because the road there's a curvature to the road. So one leg is lower, one leg is higher. It's going to affect the QL, or can affect the QL.
And a big sign that maybe your QL is tight, you might not have the pain yet, but just letting you know that your QL is tight, is if you were told one leg is higher than the other. Or when you put your pants on, you notice that one leg of your pants is higher than the other.
And that, a couple of our clients had that, you know, dress pants, and they were just like, why would that be? They can't cut it wrong. Well, they're not. There's something going on, and a good bet would be that this muscle has gotten your hips out of alignment. One is higher than the other. Okay,
what can we do?
All right, so self-care. So I want to make a point right off the bat. So we are dealing with the back, and when the back is in spasm, or it's tight, or it's just extremely tight, or maybe spasmatic, these are things that you probably shouldn't be doing or don't do. You probably need to rest it. And then when things calm down, either go and see a therapist, your doctor, but make sure you're safe. Because what we're talking about is preventative, not crisis management. Because at that point, this will just make this even worse or more angry, and you're not going to like it. And I guarantee when this thing gets really, really angry, you're not thinking about foam rolling, or you're thinking about living, you know, just surviving. So we're talking about prevention here. Self-care as a prevention. Get this thing loosened up. So me and Christina are big fans about whenever you're dealing with either a muscle or a joint, you work below and above it. And the same thing is here. When we are dealing with this muscle, we need to loosen muscles above the quadratus lumborum and muscles below it. That being the glutes, and the hamstrings need to be loosened. Might be the muscles in the front of the leg, the quadriceps. But again, we can't just isolate and go in here with something and work on this and think it's going to solve the problem. It has to be above and below the muscle, the issue, or the joint. That being said, we we are big fans of foam rolling. So you would want to take a foam roller and you would basically, for the back, just roll this against the wall. So going against the wall, if you are incredibly tight, you know, where we just know we have a tight back, the wall is probably the safest because you can't get a lot of pressure on it. And then gently moving on into 2 tennis balls and a sock tied off. And the same thing, you're going to do it against the wall, feet about 1.5 feet away from the wall, and we're just doing lowering and squats up and down and rolling the ball up and down the back. And then eventually we're going to move that into the myofascia balls. There's pink ones and black ones. And these are just hard over balls that already have the groove in here that the 2 tennis balls do in a sock. And then you're doing the same thing. So again, we're doing this on the wall. And then eventually we would just take this whole process and move right on into the floor, down onto the floor. And there's a whole sequence of events that you would do that. But that's sort of the quick, easy, gentle way to start. And then the more advanced would be onto the floor. Some really good stretches here would be if Mr. Manti just gently bent to his side, to his left, and to his right, stretching out these muscles. You can gently rotate to one side and the other. Again, gently, gently. And again, if you feel spasm, you stop and don't go any further. You can also, I'll go ahead and stand up here. A good recommended one when this thing is as tight is to take and push into your hips and then kind of pull down a little bit, and you'll feel the stretch in the lower back. That's a really nice one to do. You can lay on your back on a bed and then take, so it would be my right hand and my outstretched right leg, and I would stretch both. I would take my arm one direction and my leg the other and stretch out one whole side of my body, which will feel incredibly good.
Right.
And that'll stretch out that QL. And then you can also lay on your side on the edge of the bed. I always recommend having a partner standing there so you don't fall off. And you would just take one leg off. So you would be facing in toward the bed. Your backside would be right on the edge. And the leg on the top would you would move it over and just drop it out behind you. And that will stretch out the side of your hip and the QL. And if you bring your arm up, your whole side gets a nice stretch.
Right. Yeah. Great stretches.
Yeah, those are really good for this area and a large amount of area, but specifically the QL.
Yes. Okay. So that's our prevention tips for the QL for self-care. Yeah. Yes. So this is Brian and Christina from Your Healthy Steps, where we teach you purposeful foam rolling.
Absolutely.
And that was a great example of purposeful foam rolling, right? We
Doing
talked
it with
about
purpose.
everything that you would be foam rolling, not just that one small area that's hurting you.
Yeah.
Okay, so if you are dealing with pain, like Brian was explaining, you know you need to stretch this out, then you need to start our 3-day, the first 3 steps to a more flexible and pain-free body, which is a 9-day program, and it helps you start the first 3 steps to getting those good habits.
Absolutely, developing good habits, absolutely.
Yes, to reducing that muscular pain. So go to the link and click on that and start that program. I know it's going to help you so much. We're excited about it.
Absolutely.
Yep. Okay, anything else?
Okay. No, I think that'll do it. I think Mr. Manny's done.
Okay. So we'll see you later.
Have a great day.
Bye-bye.